Welcome to Raaonline. I am Dr. Satya Jagdish. I am Assistant Professor working in Ramchandra Medical College, Chennai. So today's topic is Hyperemesis Gravidarum. So you all know that is nausea, vomiting of pregnancy is most commonly called as motion sickness. Here it is diagnosed in the first trimester of pregnancy and other causes of nausea, vomiting have been excluded. So then only we call it as nausea, vomiting of pregnancy. Hyperemesis gravidarum is nothing but it is a severe form of nausea, vomiting of pregnancy. That is, it is a protracted disease and it has a classical triad of three things. That is more than 50% pre-pregnancy weight loss. That is pre-pregnancy weight. That should be loss should be more than 5%. Next, it should be associated with the signs of dehydration and the lab parameters should show electrolyte imbalance. When the three things are there, then we call it as hyperemesis gravidarum. So the incidence is the nausea, vomiting of pregnancy. It almost affects 80% of the pregnant women. The symptoms of women with severity vary from 0.3% to 3.6% of the pregnancy. And the recurrence rate varies from 15.2% to 81%. That means it can recur in the subsequent pregnancy also. So the risk factors are, first one is when patient has hyperemesis gravidarum, so rule out multiple pregnancy, rule out hydatidiform mode, and then other things like whether the patient has already had any history of heartburn, acid reflux, or they have experienced nausea, vomiting before pregnancy due to some estrogen based medications. These patients are more prone to develop hyperemesis gravidarum in pregnancy. Apart from that, nulli gravida is the isolated risk factor, and when they don't use any multivitamins before 6 weeks or during the preconceptional period, they are also more prone for develop hyperemesis gravidarum. So the other risk factors are motion sickness. That means the patient already has a history of motion sickness, then this patient is more prone for hyperemesis during pregnancy, or if there is a history of migraine, and if this baby is a female fetus, or if they have a family history of hyperemesis, that means not only the recurrence risk is more, if the family history of hyperemesis in their sisters or in their mother, then this patient also can develop hyperemesis in this pregnancy. And the study says that smoking and alcohol are protective factors against hyperemesis, but the risk associated with the smoking and alcohol are more. So it has its own side effects, so we cannot promote or suggest this smoking and alcohol for preventing hyperemesis. So what are the pathogenesis of hyperemesis? So they say there are psychological factors, and most commonly it is because of the hormonal changes associated with the pregnancy, and there may be abnormal GI, that is gastrointestinal mobility, that can cause hyperemesis. And they say it is recently they have studied so many patients with hyperemesis, and they found that H. pylori infection is associated with hyperemesis gravidarum, as well as genetic component also they have recently researched on the topic. So I'll talk about each one of that in the next slide. So first is psychological factors. That is, some patients they may have a conversion disorder or somatization disorder that they will project it as a hyperemesis. Or sometimes they may have a response to it is a sign of response to a stress, so they may present with the hyperemesis. These are all psychological factors. Before taking them as a psychological factor for hyperemesis, we should rule out the other causes or other pathogenisms behind hyperemesis before labeling them because of your psychological process. So what are they? First one is hormonal changes. That means during pregnancy, the estrogen, progesterone, beta-HCG, everything will be elevated. These hormones, they will relax the smooth muscles, they will slow the gastrointestinal transit time, and they may alter the gastric emptying. Not only they are relaxing the smooth muscles, slowing the GI transit time, they also relax the lower esophageal sphincter. So these two things are more reason for the hyperemesis gravidarum in many of the pregnant women.